Professor Philip Chu, Group CEO of NHG, Professor Eugene So, CEO of Tan Tock Seng Hospital and Central Health, distinguished speakers and judges, patients, caregivers, community partners, volunteers, and healthcare colleagues. I'm very happy to join you this morning at the annual Singapore Patient Conference and Singapore Patient Action Awards. Very happy that we have so many people here this morning that this lecture theatre is not big enough that we have to spill over to the opposite room and also somewhere in the alley next door. It shows that there are many people who are here to support such a very worthwhile cause. The theme of this year's conference, Volunteerism, Powering Change in Health and Social Care, acknowledges the rising importance of volunteers in care provision. As our population ages rapidly, the demand for healthcare services will increase. Many of our patients, especially elderly patients, may not have their conditions completely cured within a single healthcare session. They may need to go through a journey of recovery and rehabilitation. Hence, volunteers play a very important role in supporting our patients, both within and outside of our healthcare institutions. Within our healthcare institutions, volunteers can be the helping hand and the encouraging voice for our patients and caregivers. In the community, volunteers can help close the last mile of healthcare delivery, whether by helping to monitor frail patients or escorting them for reviews at our healthcare institutions. Many volunteers also serve as patient advocates and help us to improve our care delivery, while others form patient support groups and educate patients on how to better manage their conditions. We see many of these outstanding volunteers here today. Smiles, the winner of the Patient Support Group Award this year, is an example. This group was initiated in 2002 by a group of young volunteers who rallied their friends to jointly engage the elderly residents at NHG Hospital. They went the extra mile to plan and create activities tailored for the residents at NHG Nursing Home and have now formed very close bonds with NHG residents. Another example is the good work done by volunteer leaders at Tan Tock Seng Hospital's eye clinic. When the clinic was looking for ways to address increasing patient numbers and longer waiting times, volunteer leaders such as Madam Idawati Binte Muhammad and Associate Professor Albert Teo, worked with the healthcare team to develop a training program that allowed volunteers to take on enhanced roles, such as care navigation, educating patients on the right way of administering glaucoma eye drops, and guiding patients through the more complicated glaucoma eye screening test. As a result, patients are less apprehensive about the process, and the eye clinic also saw a decrease in irregularities in patients' eye drop regime and screening. As we engage more volunteers in the care delivery process, they will need to be empowered with new skills. Today, I'm pleased to witness the launch of the new Training and Research Institute Center for Health Activation, CHA. Now I've gotten a joke already. I don't think I'll remember what it actually means, but I'll always remember CHA. But CHA seeks to deepen the knowledge and skills of healthcare volunteers and patients. Under CHA's Hospital Elder Life Program, or HELP, H-E-L-P, volunteers will be trained to engage elderly patients to prevent the onset of delirium. Beyond performing simple caregiving tasks, volunteers will also help identify risk factors in patients who have inadequate caregiver support. In the pipeline is also a patient program in which knee replacement patients who have recovered help to encourage current patients to do simple exercises to aid in the recovery process. Apart from volunteers, caregivers are the other group of special people who are absolutely critical to patient care. Held for the third year, the annual Singapore Patient Action Awards also recognizes their kinship and tenacity. All 61 nominees have inspiring stories to share. I believe that these extraordinary individuals and groups will continue to make a positive impact on the lives of the people around them. Please allow me to share this story of a dedicated caregiver, Madam Chong Shek Mei, who supported her husband, Mr. Tan Wee Boon, when he had a severe bout of food poisoning 2 years ago and had to have his limbs amputated. Madam Chung was always there for her husband, attending to all his needs and being his greatest cheerleader throughout this difficult journey. Her unwavering love, dedication, and encouragement have fueled Mr. Tan's renewed enthusiasm and zest for life. Mr. Tan today engages in physical sports such as swimming and wheelchair rugby. He hopes to re-enter the workforce very soon and has been taking courses to upgrade his skills. He is also an active volunteer under Tan Tock Seng Hospital's Amputee Patient Support Group. Together as a team, the couple often visit other amputee patients in the hospital to befriend them, share their own story of perseverance, or just to lend a sympathetic ear. I'm very heartened to hear their story, and my heartfelt congratulations to Madam Chung on receiving the Patient Caregiver Award this year. Finally, let me end by congratulating all the winners today. Let us together celebrate the courage and resilience of our patients, caregivers, and volunteers. I hope that the good work done by these dedicated individuals will inspire more to join in this meaningful journey of building a more compassionate, gracious, and inclusive Singapore. Thank you very much.